And just like Quebec, Nunavut is another jurisdiction now turning to Ottawa for help. We're expecting to hear more from its premier at 11 a.m. Eastern about a request for the federal assistance in tackling a growing COVID case count. Right now, the territory is in lockdown with 37 active infections in 5 communities. Juanita Taylor has the latest.
Nunavut Premier PJ Akerok is concerned about the presence of COVID in the smallest, most remote communities like Pangniktok, Qigakdagjuak, and Sanagayak, where COVID is appearing for the first time.
We will need additional resources and help from the federal government to be able to respond to these outbreaks. Our frontline workers have been working just around the clock. We're at the brink of stretching our resources to the max, and I can't stress that enough.
Remote communities have health centers but are not equipped to handle outbreaks. The territory has only one hospital in Iqaluit. Chief Public Health Officer Dr. Michael Patterson is urging everyone not to take chances. He's saying to stay home and stay in isolation.
We know that there's risk of introduction in every community, and we run the risk of significant outbreaks in more communities. And the healthcare resources to test, trace, and isolate everyone involved.
Strict public health measures are still in effect Nunavut-wide until at least January 7. Travel restrictions are in place for Rankin Inlet, Iqaluit, and Pangniktok. More details are expected later today from Premier Akerok and Dr. Michael Patterson at a news conference in Iqaluit. Juanita Taylor, CBC News, Yellowknife.